Melvin and Doug Williams to stop by. Ooh-wee, mama, 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 mama. To remind us that there's purpose in our pain. It may not look good right now. Don't worry. Oh,
lately I've been thinking about you.
Hello, ladies and gentlemen. You're all welcome to the Foundation office. This is an interview with Dr. Victoria Ngwa, a renowned pediatrician in Douala. Dr. Victoria Ngwa is a volunteer to the Patcha Foundation. She has devoted a lot of her time on the Foundation's cause. The Patcha Foundation was created in 2008 by Mama Marisha Patcha with the aim of educating, creating awareness and sensitizing the population on cancer.
Yeah.
Doctor, I see you're volunteering a lot of your time to the foundation. What got you attracted to this foundation?
Mama's way touched my life. She touched me, her passion. She had gone through cancer for 8 years and she didn't want anybody to go through what she has gone. It's rare to see such human beings nowadays. Her passion, a way to express the needs of the community, touched me a lot.
Doctor, tell us what are some of the challenges that cancer patients face in Cameroon?
There's this problem of cost, accessibility. Neither the diagnosis or the treatment is accessible to the population. People are poor. People cannot afford the high-cost consultation, diagnostic procedure, not to talk about the treatment. The infrastructure is not around also to carry out elaborate treatment also. Some of this treatment can be done only in big hospitals like the General Hospital. And we have only 2 in Cameroon, in the capital and in the economic capital. Some of these regional hospitals, which are 10, they don't have the infrastructures. We want to talk about the specialists. There are very few. And then we want to talk about people's awareness of cancer. Education standards is very low. There's a lot of things that I bet you don't understand. And it's going to take time for us to understand. People are uneducated.
Doctor, you know, you talked a bit about cost. How costly or how expensive are these tests?
I'll just start with the consultation. In order to reach an oncologist is 30,000 francs. No, not 30,000, 15,000 francs.
Normal consultation. Okay.
Then, after the normal consultation, you have to do other like mammography, which is about 30, 40,000. Biopsy, which will take you about 40 to 50,000 francs. And you need also to send the whatever lump you collect to a pathologist. These pathologists are in the big centers, which means it's cost effective also. You incur some expenditures. Then we don't have to talk about MRI. Those are things that I think
it's over 100,000.
It's over 100,000. Yeah. So you know, it's not to the public.
Right.
Yeah, they cannot.
Yes. And thank you very much, Dr. Ngwa. Thank you. Ladies and gentlemen, just to reiterate that the Patcha Foundation is all about education. Education about being aware of your own body, knowing your body and your body parts, such that when there is an anomaly, you can quickly run to your healthcare provider and get the necessary test. Education about healthy lifestyle, These are all things that can prevent these diseases. Hi, I am Melanie Forjo. I work with the Michael and Marisha Patcha Foundation. Today we'll be talking with Dr. Tony Njikam, a well-renowned pharmacist, about the situation of cancer in Cameroon and how the difficulties and challenges cancer patients face in getting their drugs. This being the Breast Cancer Awareness Month, we're going to be having a lot of sensitization going on, and we'll be preparing other activities, and his interview is going to help us shed more light on how to get the drugs and what cancer patients go through in general. So I'd like to find out, what is the general situation you face with cancer patients in Cameroon, the general experience?
Most of the patients have a problem trying to get the drugs the doctors prescribe. And in most cases, they're very expensive drugs. Most of them are not registered in Cameroon, and they don't have, that means we cannot sell them in the pharmacy. So we're obliged to import them express, and they come by courier. This raises the cost of the drugs, as you know. So we are there to satisfy these patients and make it easy for them to procure these drugs.
Okay, so can you just tell us the common drugs which patients have? Is it affordable for the average Cameroonian? We know Cameroon is an underdeveloped country. Is it the average drug for a cancer patient? Is it affordable?
Unfortunately, most of them are expensive, and well, those who are insured don't have any problem because they go through the insurance companies to get these drugs. But as you know, those who are not insured, they have to rely on some other relatives to get these drugs for them.
As a pharmacist, do you know any support groups, or is there any in Cameroon which patients turn to for help when they cannot afford these drugs, like they help them subsidize, or the government also helps subsidize these drugs?
To the best of my knowledge, no. We don't have, unfortunately, there's no social security program in Cameroon, so the government actually, what they do is through Sename, they can get some of these drugs, but not many of them, not many.
I'm here with Mrs. Jacinta Satya in Bamenda, Cameroon. Cameroon is a low-income, underdeveloped African country. Mrs. Jacinta Satya, I would like to find out, are you a cancer survivor or a patient?
Actually, I can say both, because I was diagnosed with thyroid cancer with metastasis to the sacrum. The thyroid was removed, that is, they did a total thyroidectomy and removed the thyroid. But at the level of the metastasis in the sacrum, nothing yet has been done. Nothing has been done yet. So I guess for the fact that I'm alive and surviving, I could say I'm a survivor, but at the same time I'm still a patient because of all the negative effects, the pain that I have on my legs, which is caused by the mass in the sacrum. That period of no diagnosis was actually due to the fact that I was still in Cameroon. I was in Bamenda. I went to several doctors, and I think they did not just think of doing the right test, and they could not come up with a diagnosis. And in July of 2010, when I went over to the United States of America, I was then, the proper test and everything was done, and I had the diagnosis then.
So now you're back in Cameroon. What are some of the challenges you face with your follow-up on your health and getting your drugs?
Actually, the challenges were quite many, because First of all, I'm in Bamenda, and to the best of my knowledge, I've been asking. There are no oncologists in Bamenda. Right now, I'm trying to connect to an internist. I'm still yet to do that. I'm yet to do that. I'm sorry. I'm yet to do that. Getting to a doctor is quite difficult, and to talk about a specialist. And if I have to be connected, I'll have to be traveling to Douala or to Yaoundé, and that still is another challenge, given that I have problems with my legs. So, and of course, getting my drugs is still as difficult. They have to be ordered. I have to see a pharmacist who can place the orders when the drugs have been written by the doctor, prescribed by the doctor. They are very, very expensive, and not even available. They have to be ordered.
Okay, so I want to go back to a point you made earlier. It was the proper treatment or the proper diagnosis was not made. Do you feel like almost half of the cancer patients or many cancer patients in Cameroon go through that? Are they diagnosed when they're supposed to be diagnosed, or does it get to a later stage before it is noticed?
It will generally get to a later state or stage before it is noticed, because when you are sick, for example, if you have fever, you go to the hospital, they want to treat you for malaria first, and after a series of treatment for malaria, if the malaria is not going away, maybe they want to, add some typhoid treatment, and then they go through those stages and
go to the normal tropical disease.
Because of our level of poverty, no doctor is willing to write a series of tests which you can do so that he will immediately see where your problem lies. They go through a process of elimination. And in my case particularly, since my legs are paining, and the symptoms are the same like that of those who have a sciatic nerve problem, as it is always called, a sciatic nerve problem. I was being treated for sciatic nerve.